Hello, my name is Dr. Punekar, and in today's teaching for the MRCP PACES examination, we're going to look at neurology for PACES. What we will do is show you how to approach neurological examination and then go on to show you 2, 3 or 4 cases that are commonly seen in the PACES examination. Hello.
Hi.
My name is Dr. Punekar. I'm your examiner for this station. Is that Dr. Khan?
Yes, that is.
Okay, so we have this gentleman who has been having several falls at home. Would you like to examine him, please, neurologically?
Yep.
Thank you.
Hi, Mr. Thomas. My name's Dr. Khan, and I'd like to examine you today, if that's okay. All right. I can appreciate Mr. Thomas has a resting tremor. I can appreciate that he's got reduced facial tone and expressionless face. All right, Mr. Thomas, I'm just going to quickly examine your hands, if that's okay. Now just the other hand. I can appreciate rigidity, but more so on the right, with the tremors also more on the right. All right, Mr. Thomas, can you do that for me? Can you copy my movement and as fast as you can? You can rest your hands now. I can appreciate bradykinesia in his right hand, more so. All right, Mr. Thomas, would it be okay for you if you can take a few steps for me? I'll just be right beside you. All right. I'd like to assess the cognition of the patient.
Okay, not now actually, maybe later. Yeah.
Thank you. I'd like to assess the eye movements.
Please go ahead.
All right. Mr. Thomas, can you look at my fingers and just follow my fingers with your eyes without moving your head, please? I was assessing for a vertical gaze palsy that could have been suggestive of progressive supranuclear palsy, but it is negative. All right. Mr. Thomas, I'm just going to ask you a few questions, okay? Where do you live? Did you have your breakfast this morning? All right, thank you. I'd also like to check for the lying and the standing blood pressure to assess for postural drop. That
Okay, no, we'll give you readings later.
All right, thank you. Mr. Thomas, I'm just going to ask you to do a few movements with your hands, all right? Can you take the palm of your right hand and can you do this repetitive back and forth movement for me? As fast as you can. Perfect. Can you do that with your left palm now? All right, that's fine.
What would you like to demonstrate? Why have you done this test?
I'm trying to look for cerebellar signs that could be part of Parkinson plus syndromes.
Such as?
Multi-system atrophy.
Okay, go ahead please. Yeah.
Mr. Thomas, can you touch the tip of your left index finger to your nose? And can you touch it back to my index finger? And do that as fast as you can. Right, thank you. Can you do the same with your right index finger? As fast as you can. That's okay. You can put your hand down. Mr. Thomas, can you draw a spiral as I've done here?
Fine.
Thank you. All right, Mr. Thomas, can you tap your right foot as fast as you can? Right, thank you. And your left foot as well? Thank you. Thank you, Mr. Thomas. I'd also like to do a complete neurological examination to complete my neuro exam.
Okay, no problem. Thank you.
Thank you.
Would you like to present your case, please?
Yes. I examined Mr. Thomas today. He had tremors, rigidity, and bradykinesia worse on the right.
Okay.
He had an expressionless face. His gait was short and shuffling with evidence of festination.
Excellent.
He also demonstrated micrographia, and his speech was soft and monotonous.
Okay.
There were no cerebellar signs or any vertical gaze palsy, which could have been suggestive of Parkinson plus syndromes.
Okay, that's good. Okay, let me just ask you one or two questions, if that is okay. What would you like to say is the mainstay of therapy or pharmaceutical treatment in patients with idiopathic Parkinson's disease?
It is levodopa.
Levodopa therapy, yes, excellent. Can you think of any complications associated with levodopa therapy in patients with idiopathic Parkinson's disease?
There are a few complications, to name a few. Postural hypotension, which could then lead to exacerbation of falls in these patients.
Yes.
Second that's coming to my mind is levodopa-associated dyskinesias.
Yes. I mean, dyskinesias can be a problem in these patients. Can you think of ways how you might reduce the dyskinesias in such patients?
There are a couple of things we can try. We can try and spread out the doses of levodopa throughout the day.
Yes,
so they can have
reducing the size of each dose.
Yes, so they can have multiple smaller doses.
Okay.
The other thing to consider is therapy with amantadine.
Right, okay, good, excellent.
Thank you.
Hello.
Hello.
My name is Dr. Punekar. I'm examiner for this station. Is that Dr. Laura Powell?
Yeah, it is. Yeah.
Okay, so this is Mr. Owen Blackwood. He has been referred to you with ECG abnormalities. Would you like to examine him neurologically, please?
Okay. Yeah. Good afternoon, Mr. Blackwood. My name's Laura Powell. I'm one of the doctors here today, and I've been asked to come and examine you, if that's all right.
Nice to meet you.
Could you just confirm for me your name and date of birth, please?
It's Owen Blackwood, 1484.
Thank you. So I'll try and be as gentle as possible, but if you'd like me to stop at any point, just let me know.
Thank you.
Yeah.
So if you could just make a fist for me, like this, and release as quickly as possible. Thank you. And I'm just going to have a little look at your hands as well, if that's okay. I'm going to press here, then release. That's just looking for percussion myotonia.
Okay,
I'd then also like to do a cognitive assessment.
we'll do that later, yeah?
Thanks. So he has some frontal balding,
Yes,
and I'd also like to just have a look for cataracts, if that's okay.
okay.
So if you could just stare straight ahead, I'm just going to shine a light in your eye, if that's okay. Again, this side. And if you could just raise your eyebrows for me, please. Okay, and screw up your eyes really tight as you can. And open your eyes and show me your teeth. Great, and if you could puff out your cheeks for me, don't let me push it in. And then clench your teeth for me, and I'm just going to again just feel it. See. So he's got facial weakness with weakness of the muscles of mastication.
Okay.
Is it alright if I just have a listen to your chest next?
Of course.
And feel your pulse. Let me feel your pulse first. Like. Okay. And if you don't mind just lifting your shirt so I can have a listen.
Would you like to do anything else?
So I would like to take a full history, have a look at his ECG, get an EMG and also do genetic analysis.
Okay, so what is your diagnosis?
So my diagnosis would be myotonic dystrophy.
Excellent. Okay. You mentioned about genetic analysis. What is the inheritance pattern with this condition?
So it's autosomal dominant inheritance and can be type 1 or type 2.
Okay.
It also shows anticipation, so successive generations can have more severe symptoms with an earlier onset as well.
Okay. Can you think of any cardiac complications that patients like Owain might expect?
So they can have conduction defects
Okay.
and long QT syndrome.
Yes.
Can also have mitral valve prolapse,
Okay.
ischemic heart disease, cardiomyopathies, and also heart failure.
Okay. And can you think of any respiratory complications they might have?
So they can also develop diaphragmatic weakness,
Yes.
which can then lead to
Yes.
respiratory failure, and they
Yes.
can also have obstructive sleep apnea as well.
Okay. Excellent. Thank you.